Good evening, friends. So we will try to revise the previous one. As the purpose is revision the chanting, the purpose is again I say revision so that we can retain in exam and we can do few question reflexly. And this is the most important thing. That when we do question reflexly, this give us confidence. And these I have taken these questions, four questions previously asked or recently asked questions. So please do reply. I have discussed with mnemonic which of the following is not cardiodepressive. Please do reply. What is the answer? So in this, the answer would be atomy date. I told you it is my date. If your date is there, definitely your heart will not be depressed. Your heart will be stable. Okay. Yes, atomy date. Yes, I told you this mnemonic. It is my date means it is no cardiac instability. Okay. Now, anesthesia gas with maximum respiratory irritation. I told you two. Desflurane means disgusting taste, and isoflurane. I for irritable. Okay, irritation. So disgusting and yes, isoflurane is not given, so no need to worry. Desflurane. Okay. Sevoflurane, it is sweet. Blue pipeline, I told you blue matlab neela. Neela means neela nitrous oxide. So blue pipeline, blue cylinder, yes. So these are recently asked questions. Now circuit of choice for spontaneous ventilation is, I told you Maffelson A, that is Magill. So Maggie is yes first or A, Maffelson A, and you eat Maggie spontaneously. So spontaneous is best, and expiratory valve is near the patient. Yes, while Maffelson D, Bain circuit. Yes, Bain the control Paji control. So you all know. Yes, in this BC बकवास है, BC frequently used. So these are 19-20 question NEET and FMG. So you can easily remember. Simple questions are asked. AMBU Ambu bag picture MCQ is asked. They gave this instrument, and in instrument you will find yes this valve. This valve prevent rebreathing. So non-rebreathing. Artificial manual breathing unit. And in this we can give by this 100% oxygen. Okay. Now second instrument picture MCQ, Guedel airway. In this you will find that it is used, this airway is used to prevent tongue fall on posterior pharyngeal wall. Yes, if you see the structure of G, yes, if I rotate, it looks like tongue. And it is, yes, the curve is just like tongue. So it prevents the tongue fall on posterior pharyngeal wall to prevent, yes, airway blockage. In this, a question is asked. Suppose a tray is there. Yes, a question is asked like this. They will give you a tray. Okay, in this tray you will find that different size of Guedel's airway are there. You want to choose the correct one. What is the, how you will choose the correct size? Yes, you measure from the angle of mouth to the angle of jaw or ear, and that is the correct size. So this is Guedel's airway. Clear? So picture MCQ, this airway you can laryngeal mask airway, LMA. This is very important. Yes, if you find the difficult intubation, yes, you all know when we intubate the patient, we make a particular position, barking dog position or morning sniffing position. Okay, that is intubation. Yes, in intubation, you find difficulty if cervical fracture is there, or means sometimes you try and you fail, or if you find difficulty that you feel that it would be difficult. This laryngeal mask airway is very easy. LMA is very easy. You place directly, means even a paramedical staff can use this. And what are the indication? Alternative to failed or difficult intubation means you are unable to intubate, or you feel yes that you can't do that. Yes, you will remember that nowadays it is also used as elective alternative method for intubation. Okay, but you will remember this one, that is quite important. And in this benefit is there is no need of muscle extent. In intubation we use muscle extent. No laryngoscope is required. In intubation you require laryngoscope. So this is very easy to place. But in intubation you will find there is intubation is very secure thing. No, very less chance. Okay, you can't say absolutely no, but very less chance of aspiration, means gastric content will not come to the airway in intubation. But in this laryngeal mask airway you can see this is cuff. It is placed on the laryngeal opening. So even after best effort you will find that some leakage may be there. So there are chances of aspiration. There are chances of aspiration. Yes. Yes, increase disadvantage, it is said, increase risk of aspiration. What is the benefit? Avoid complication of intubation. Intubation, we do sometimes intubation and multiple attempts are done. Easy to use, no laryngoscope, no muscle relaxant required. And if fracture cervical spine is there, even you can use laryngeal mask airway. But as I told you, there are chance of aspiration, means you placed on laryngeal opening this, yes, this some area of yes esophagus, means opening, would be also covered. And when you will give air through this, then some air will go to stomach and there would be inflation. This will lead to this will increase the chance of aspiration, means content will come out and will go to airway. So what we do in this laryngeal mask airway, you can't do anything. You have no space to put Ryle's tube. But what we did, yes, we use now second generation LMA. What is second generation LMA? In second generation LMA, you will find that there is one more tube for gastric deflation. Means Ryle's tube, you can put Ryle's tube through this. Okay, so means you can deflate the stomach. So there are decreased chance of aspiration. I gel for India, I for India. Okay, in India most commonly used is I gel. Okay, in this, in place of cuff, yes, this air, we use air to inflate the cuff. In this is replaced by gel. When this is replaced by gel, so it is means you can say less chance of rotation. Sometimes what happen, laryngeal mask airway rotate and block the airway. Now this is LMA supreme, means super. What we did little bit modification. This you can recognize. How you will recognize? Yes, this is bite block. Means if you are given picture and they ask, yes, which LMA is there, I for India, I gel, okay, LMA, you will see this bite block, even this supreme means it would prevent the bite. Second thing, the shape is little bit curved, so it is too easy to place. So shape, you can recognize by shape and this bite cuff. In this gel, you will recognize. If this is second generation, you can recognize that two tubes, second generation. Okay. LMA very easy to place, means if you find that it's difficult to intubate, immediately you can put laryngeal mask, airway. It is very easy. Now face mask. Yes, these are face mask, very easy to recognize, and they increase the risk of aspiration. You know, if positive pressure you will give, yes, positive pressure ventilation, definitely this air will go to stomach and then aspiration chances are there. Clear? Now if we talk about intubation, you will find that first blind intubation was done, means without laryngoscope, by McGill. Yes, that is Ivan McGill. Yes, means without laryngoscope, blind, okay, intubation. But we do intubation with the help of laryngoscope. In adult we use Macintosh. Yes, in adult curve is there. Yes, curve, adult, okay, you know. Miller's laryngoscopy, okay, you will find flat blade. This is blade of laryngoscope. This is curved. So if question is asked, if picture is given and if you find a curve, yes, this is Macintosh. Okay, if it is flat, this is Miller's, and this is used for children. Okay. In laryngoscope, you may find that what is the position. This is frequently asked question, old question. Yes, barking dog position or morning sniffing position. Okay, barking dog or morning sniffing position. Yes. Now, so you can, this is recent, you can say, no different types of children, means neonate different, children different, same as Dr. Ajay has clearly mentioned in his videos, that same for all children. Okay, no need to get confused by different names. Okay, Miller's. Video laryngoscope, it is having very high success rate. You can easily understand, if you are visualizing the thing, then you can easily place the tube and you can see that, okay, at this place I should, at this pore I should put or not. Okay, so very high, means even if you, means if you try to intubate with the help of normal laryngoscope and you fail, then the success rate is 90 to 95% that you will be, so you can easily identify it. Okay. Now, so picture MCQ, most of time we found that they want you to identify things. Okay. Endotracheal tube. Yes, I just told you that laryngoscope is used to put endotracheal tube, and these are made up of PVC. In this low pressure, high pressure, leave it. Cuff can be used in, this is update. Previously we used to say that we should not use cuff below the 10 year of age, but now we say no, even in infant we can use the cuff. Okay, so you will remember cuff can be used even in children. So this is update, and this is endotracheal tube. In this Murphy eye is there. So question is asked, this is not a new question or very old question. What is the size, okay, of endotracheal tube? What is the size of endotracheal tube? Yes, you can easily remember, male 8 or 8.5, female 7. So F, I usually say that many times if you start making mnemonic, you become habitual, and every time you will find same mnemonic again and again and different subject, just like female F. looks like 7. F looks like 7. And M, yes, I write M like this and like this, and it becomes 8. Okay, so this is the, yes, number indicate 8 or 8.5 indicate the inner size of inner diameter in millimeter. Yes, in millimeter. And if children is there, yes, if children is there, then in children you will find that, sorry, in children this is the formula, this is the formula. Age in year upon 4 into plus 4.5. Suppose age is, they gave in question, there is 8. So 8 divided by 4 plus 4.5, 2 plus 4.5, that is 6.5. So they can ask this simple question and you can easily solve. Okay. RAE preformed tube. Yes, this is RAE preformed tube. Okay. This is used for oral surgery. This is used for oral surgery, oral RAE. Okay, so oral RAE. I try to write this. I know that this is not a good mnemonic, but sometimes what happens, just like you are doing chanting, just like you are watching this video, sometimes these pictures, these words remind us, because we have so many types of memory. As I told you that in my class also, that we have each and every type of memory. Emotional memories are there, smell, touch, feel. Okay, so many things are there which can remind us. Okay, flexometallic. In this metallic thing is there, so there would be no kinking. Yes, suppose a you must have seen a PVC pipe. It can be folded easily, and there it can block the airway, or it may block the water flow also. You must have seen in pipes. Okay, but if we put metallic thing, that it is not kinking. Okay, not kinkable. It is used for head and neck surgery. Okay, so why they have folded it? Sometimes they will fold it like this, just to show you that if it would have been without metal, if it would have been without metal, then what would happen? Yes, there would be kinking. So they try to, yes, sometimes these pictures means they will not show metal. Yes, you can't see in this picture metal, but you can say, yes, even after folding it is no kinking, so this might be flexometallic. Okay. Double lumen robot show, one lung ventilation. In two lumens are there. When you reach the bifurcation of trachea, you can put, yes, one means one tube goes to one lung. So one lung can be ventilated at a particular time. If you want to ventilate one lung, you can ventilate. This is double lumen robot show tube. Yes, you should identify these oxygen delivery devices. This is nasal cannula. You must have seen the person walking, keeping it. Yes, this is oxygen mask, O2 mask, simple oxygen mask. You must have seen many times. With reservoir, this is reservoir O2 mask. I know that this is not a clear picture, but you will identify Venturi mask. Yes, in this Venturi mask, different colored mask. Yes, you can regulate the flow, and fixed O2 delivery devices there. Venturi mask. So wherever you find multiple colored wall. Okay, so these are few. Yes, now we come to local anesthesia, LA. Yes, this is always controversial. You will find in physio and in anesthesia. I do remember during my preparation, I prepared 2 times in my life. Yes, you all know. And yes, in preparation, I found this was every time controversial, but we can easily resolve the controversy as per our Dr. Ajay. He analyzed and also found that there may be, yes, peripheral nerve block and central nerve block. Yes, central nerve block I will discuss, don't worry. I have touched the topic in previous discussion. So peripheral nerve block, you will remember, periphery means in hand. Suppose hand limbs periphery. And in this back we give spinal, epidural, that is a central nerve block. You can easily remember central nerve block means epidural or spinal, and in peripheral limbs you may remember. And I say A B C D E F G H I J K L M, so A B C, A B C, and central B A C. Okay, BAC. So back, this is back, you can easily remember. This is ABC, peripheral ABC. Okay, you will remember like this. Now means if they are saying that it is a nerve block and they don't mention peripheral or central, then you will consider peripheral. Yes, I found that in central they will mention it is spinal or epidural. That's why we are conventionally using like this. Okay. So peripheral nerve ABC, central nerve BAC. Okay. And yes. Now nerve fiber gamma, delta, alpha is equal to beta BC. Now we found that if you see the spinal nerve, okay, spinal nerve, you will find that most outer is autonomic. Autonomic is most outer. So when we give central nerve, yes, I mentioned, if you remember in previous class, yes, I told you that's epidural and this is spinal. Yes, epidural is spinal. Okay, and we pass different structure, and first spinal was given by August Beer. Yes, nice beer. I have tried it once. I'm just joking. I never take alcohol. Okay. Yes, and you should not take. You know, alcohol decrease the B1. Yes, decrease the B1 in our body, and B1 deficiency can lead to beriberi, dry beriberi, wet beriberi. Okay, and Korsakoff psychosis, Wernicke's encephalopathy. B1 is very important, and when we take alcohol, alcohol decrease the absorption of vitamin B1. Okay, so never ever take alcohol. Yes. So means when we give this is you will find spinal nerve, most outer is autonomic, then sensory, the inside is motor. So when the means the blockage would be first autonomic, then sensory, and then motor. In peripheral nerve block, it opposite to this, motor, sensory, and autonomic. Clear? Now one more, yes, question. This question was recently asked. Mechanism. What is the mechanism of action of local anesthetic? LA. What is the LA? If you apply LA, LA goes inside the nerve and block the sodium channel from inside. Block the sodium channel from inside. Okay. Okay. So which channel are blocked? Please do reply. Answer. What is the answer? Yes. What is the answer? What is the mechanism of action of local anesthetic? LA. What is the mechanism of action? Yes, sodium channel. And they, if they want to ask specifically from outside, from inside, from inside. Okay. LA can be divided into two groups on the basis of their chemical structure. If they are esters, the name will have only one I. If they are amide, the name will have two I. This has been asked many times questions. They ask this is ester LA or amide LA. So you can remember by counting the I. If one I, two I, amide, I, yes, I. Yes, in this only one I. These are esters. Okay. Now, a question is asked, prelocaine, yes, cause meth hemoglobin. Yes, primary math. I do remember, yes, we are concerned with primary math. Being a medico, we have never understood math. So if we could understand primary math, that is okay. So primary math, prelocaine, methemoglobin. Lignocaine, you know very well, yes. Whenever we give lignocaine, we can use lignocaine by two method. Either we give it with adrenaline or without adrenaline. Why? What is the purpose of adrenaline? Adrenaline cause vasoconstriction. So if we apply la and adrenaline also, so vasoconstriction occur and the blood means la will not go beyond that area. Only that this will be limited to that area because vasoconstriction would be there and blood will not take LA, this lignocaine to any other place. Okay, so without adrenaline, this lignocaine will flow via blood and the yes duration would be 45 to 60 minutes. But to increase the effect, we can use it with adrenaline and it is effective for how many hours? 2 to 3 hours. Safe dose is the safe dose. If this go via blood and go to heart, that it can produce side effect. So without adrenaline you will give less dose. With adrenaline you will give more dose. With adrenaline, because the LA will remain, lignocaine will remain in the localized area, so it will not go to heart, so you can give more dose. Clear? Now, next is, so lignocaine you will remember. Now, bupivacaine. Bupivacaine, what I do, yes, I make mnemonic. I remove 2 letters every time. I remove 2 letters every time. And now bike, car. I know that these mnemonics are, sometimes you think that what rubbish mnemonic these are. Yes, anything, kuch bhi. But dear, kuch bhi you will remember. If you will remember kuch bhi, then if you do like this is the rule. Yes, whenever we put some unusual thing, that is remembered for a longer time. You must have experienced that in your life also. So duration 2, maximum safe dose 2. So by matlab die by 2, and bike, car, it is cardiotoxic. Very commonly asked question. Cardiotoxic. Okay. And what we did, yes, we made, or not we, means it was developed, levobupivacaine. It is less cardiotoxic. Ropivacaine, less cardiotoxic. Okay. Amla cream. In Hindi, एमला मिला रखा है 2 चीज़ों को. किस किस को? प्रीलोकेन एंड लिग्नोकेन. लिग्नोकेन इज ऑल्सो कॉल्ड लीडोकेन. ओके, मिला रखा है. ओके, क्या क्या मिला रखा है? प्रीलो एंड लिग्नोकेन. ओके. Peripheral nerve block. Yes, peripheral nerve block. This is important. Brachial plexus block. In this, sometimes questions are asked. Intrascalene means brachial plexus. You all know brachial plexus. You are very well aware about brachial plexus. And yes, I know that if you will remember by anatomy, it would be very easy. So I don't say that I will give you the exact anatomy, but this is the rule, yes, of memory. Again I am saying, this is chanting is not only by mugging up, by repeating the things again and again. I will give you a way how you can make mnemonic, how can you can train your mind. Why I have started, I know that I am not expert on all 19 subject, but I am expert in making mnemonic, and I know the memory technique concept. So in different types of or you can, in different subjects we can apply different techniques. Just like in, yes, if you remember conceptually exact anatomical thing, that you must not be here. Okay, I am making things simple. Okay, yes, but yes, scalene muscle is here. Some yes, here. So intrascalene, yes, if you inject, yes, so if you see ulnar nerve, if I inject here, if I give here, okay, block, so definitely the lower one may be spared, yes or no? And you all know ulnar nerve supply hand, ulnar nerve supply hand, so hand is spared, hand is spared, okay, yes or no? So if you want to give brachial plexus block and you want to do surgery on hand, you will never give intrascalene. So they can give clinical question on it. Okay. Supraclavicular, if I give here, yes, if you remember little bit anatomy, yes, you will find that yes, supraclavicular is small portion of pleura is there. Yes, apex of lung is there. So there may be chance of pneumothorax. Infraclavicular, yes, if I put here, so there are chances of failure rate is high. So if I put here, failure rate is high. If I scalene, this is spared, so hand surgery it is not used. Yes, if I give in axilla, so this musculocutaneous nerve may be spared. Musculocutaneous nerve be spared, axillary. Okay, so little bit idea. Yes, central neuroaxial block, that is yes, I have already told you something about this structure, that epidural and spinal. Yes, yes, above the dura, spinal, yes, inside the, yes, subarachnoid space, inside subarachnoid space is having CSF. So if you want to give spinal, yes, you must take care of spinal nerves, yes, that is spinal cord. We found that infant extension of spinal cord is up to L3. So in infant we can give below L4. So L4, L5. In adult, L2, L3, lumbar puncture also, yes, like this. Structure encountered: skin, subcutaneous tissue, supraspinatus ligament, interspinous, ligamentum flavum, dura, arachnoid matter. And I told you this question was asked in lumbar puncture. The last structure which will be punctured, that is arachnoid matter, yes, because it's subarachnoid space. Yes, you may to spinal anesthesia and lumbar puncture, same thing. Okay, position, sitting, lateral. Okay, needle may be of two type: dura cutting or dura separating. Simple, name itself tells you cutting. Previously we used to cutting needle, that will produce means more leakage. Yes, in spinal anesthesia the disadvantage is that yes, there will be leakage of CSF, and that decrease leakage when person is sitting, that would be some headache would be there, yes, stretching would be there. Okay, and what, yes, in dura separating there would be less spinal headache. Definitely, if you are separating, if you separate thing, you remove again, but if you cut, then more chance of spinal headache. Drug, we use hyperbaric drug. Why we use hyperbaric drug? Yes, because you are giving in spinal CSF. This Bupivacaine means these LA which are you are giving in CSF flow, this may flow with the CSF and go to upper level. Yes, paralysis may occur. Yes, side effect you will find that yes, there may be yes, complete, paralysis may occur. That's why what we do, yes, we use hyperbaric means their density is high, so they will remain below, means they will go below rather than going above. Okay, so systemic effect, yes, sympathetic system is inhibited, hypotension, yes, intraoperative hypotension most common, post-operative urinary retention. Okay, management, Yes, small gauge pencil tip should be used. Yes, prevention, we can prevent, I have told you. Management, hydration, if you give adequate hydration, definitely. Yes, because CSF is mainly water. Okay. And ask patient to remain in supine position. Supine position, yes, then there would be no stretching. Okay. And autologous epidural blood patch, suppose there is leakage of CSF, what we do, we inject some blood will clot, and then this is called autologous epidural blood patch. This is very very important. Meningitis may be there, and this is due to streptococcus viridans, and this streptococcus viridans comes from the mouth of doctor. Okay, that's why we say whenever we do this lumbar puncture spinal anesthesia, we always put mask. In fact, nowadays we are putting mask without any reason. Okay, but reason is there. So now we start saying like that. Yes, epidural means above dura. Toe is outside the dura. Needle type is this. Okay. Now I think in this no post-spinal headache, less hypotension, okay, duration of block can be changed. What does it mean? Means in this epidural we left the that cannula in place, and we can give further drug to increase the duration of the block. Yes, muscle relaxant, little bit faster we will try to cover. Yes, sequence of muscle blockage. I think I have not left any question. Yes, sequence of muscle blockage: central muscle, then peripheral. Okay, and reversal is how we do monitor that muscle is relaxed or not. Ideal muscle is corrugator supercilii or orbiculis oculi, but you will not, yes, you put electrode here and there, and that is near eye, so we avoid. And the hand is near us, we are giving anesthesia. Yes, we can check by seeing the power of adductor pollicis, this adductor pollicis. And yes, adductor pollicis, how to remember? Yes, better is this, but we say yes, when we are doing hand is near, so adductor pollicis we can check. And adductor pollicis is yes, adductor pollicis is mainly by supplied by ulnar nerve. Adductor pollicis supplied by ulnar nerve. This question was asked. Yes, adductor pollicis is supplied by ulnar nerve. This question was recently asked. Yes. Most common nerve. Yes, they are asking question like this. Means same thing but little bit modifying. Most common nerve used for monitoring in anesthesia is. Please do answer. Now classification: depolarizing, muscle relaxant and non-depolarizers. Okay, let me tell you depolarizer kya hai. What is depolarizer? Means just like acetylcholine depolarize the muscle, okay, the membrane. Succinylmethonium, okay, depolarize. When depolarize, muscle contraction would be there, and in that depolarization state, if you give second stimulus, you must have read in physiology, if a cell membrane or nerve membrane, any membrane is depolarized, if you give stimulus, that is not excited again in a refractory period. So for a short period, this will become refractory to stimulus, so depolarizing muscle relaxant. Okay, and succinylmethonium onset is very rapid. Yes, what we want? Yes, if you want to intubate, as you give, immediately the effect should come, and it should be short lasting. So this is very short. So this is succinylmethonium is ideal for intubation, but it has side effect. Yes, just like ketamine. I told you, ketamine increases all pressure. Yes, all pressures are increased in ketamine. So in this ketamine, yes, in this succinylmethonium, yes, suction if you see suction, suction is having very high pressure. Yes, anesthesia we use suction here, and so a very high pressure. So suxamethonium, high pressure. So it increase high pressure. When it depolarizer, muscle contraction occur, general muscle contraction occur, there will be release of potassium, hyperkalemia. Muscle contraction would be there. After that, there would be pain in muscle. Yes, if you do heavy exercise, after that there would be pain, muscle pain. Sometime you will find that patient predisposed to malignant hyperthermia. Suxamethonium is a predisposing drug. This is as in contraindication, that is hyperkalemia. Okay. So yes, I think these I will leave this. Prolonged block. Yes, prolonged block is important because you know that sometimes low pseudocholinesterase means suxamethonium is degraded in our body by pseudocholinesterase. So if low pseudocholinesterase, the block will be prolonged, or abnormal pseudocholinesterase. Yes, liver abnormality also there would be, because this is degraded in liver. Okay, abnormality may also prolong the block. Non-depolarizer are competitive. कोई depolarize नहीं करेगी, this will not depolarize, they will compete, and these are obsolete. So I write mnemonic for this, although I think if these are obsolete, no need, but sometimes they can ask doctor tu gali na de. So first of thing you will remember doxacurium, tu tuberculare, gali गैलामीन, ना दे मतलब मत दे, obsolete, अब मत देना. Second thing, ना दे मतलब non depolarizing. So at least you must know that these are non depolarizing. Okay, tuberculare, gैलामीन, doxacurium. Vicuronium, yes, most cardio stable. I know these are not good mnemonic, but I can make like this, heart. Okay, V means cardiac stability. Okay, cardiac stability, and your heart is happy. Okay, pancuronium, pan, P-A-N, read it opposite, N-A, non-adrenaline, so hypertension, release non-adrenaline, so hypertension. So many these questions, just like I told you that small questions are being asked. Okay, and few clinical questions are also asked, but if you know these things, you will find they will give a clinical scenario in which they will tell you that the BP is already high. Then you can easily mark that yes, which should not be used, pancuronium. Okay, previous history of cardiac things are there, then which should not be used, which can be used, yes, vicuronium, like that. So you will atracurium. Yes, sorry for those who don't know Hindi. 17 बरस की ये गाना था ना, that was okay, but 18 means 18, 18 means 18 years, is a boy, is not man. I am a man in black. Okay, and 18 साल का तो man होगा, half man. Okay, because I am around 40, so I am a man. Okay, and you are boy, so you are half man, you will mature and become a man. Okay, oh man. Yes, so Hoffman, atracurium, Hoffman degradation means it's not affected by renal and heart failure. You can give in renal and hepatic failure. Okay, it can be given. This is frequently asked question. Okay, atracurium. Okay, now Yes, as we know that we are here for important aspects, so I will try to restrict the discussion to important one. Okay. Yes, one thing I would say that airway assessment. Yes, airway assessment. Yes, what is, yes, you must assess the airway before anesthesia. Yes, pre-operative assessment you must do. Yes, for airway assessment, we do first of all mobility of neck. If neck is movable or not, first thing. Okay. Second thing, you check thyroid and thyromental, thyromental distance. Why? Because hypognathia. Yes, if a jaw is small, that there is difficulty in intubation. Okay. So hypognathia. So two things we can do. Yes, this is means important, but other than that, you will check that opening of mouth is sufficient to put the tube. Yes, intubate. Can you intubate? If you want to intubate, definitely a mouth should be open. So yes, for that we say modified Mallam Patti scoring. Yes, sometimes the tongue is very large, that is obstructing the means intubation. So for check we check modified Mallam Patti. So yes, I have taken this. In this class 4 कंप्लीटली चारों दिशाओं से बंद हो गया है, ये सब बंद है, चारों दिशाओं से बंद है, सब कुछ बंद है, एवरीथिंग इज ब्लॉक्ड, नथिंग कांट बी सीन, uvula is not visualized, no structure seen, only soft tissue, चारों दिशाओं से बंद, all four directions are closed, you can't intubate. Yes, can't intubate, you can't intubate. If only base of uvula is visualized, means a little bit thing, base of uvula means if you open the mouth, yes, you can see a normal person, these are tonsillar pillar. Yes, this is hard palate, this is soft palate, this is uvula, tip of uvula. Yes, means if it is blocked, say only base of uvula is visualized, then it is class 3. This is difficult intubation. Okay, no intubation at all. Actually in this you will find little bit difference, so no need to worry. Class 2 easy intubation, class 1 easy intubation. Okay, so you can remember this Mallam Patti scoring, Mallam Patti करनी पड़ेगी भाई. Yes, this question was asked recently. Modified Mallam Patti grading is used in the assessment of okay, difficult intubation. Okay, this question was asked. Yes, the image below done for airway management include. Yes, airway management head tilt. This is head tilt, chin lift. Yes, if a person is like this, so this is airway is blocked. You open the airway by head tilt, chin lift. Head tilt, this question recently asked. Head tilt, chin lift. You can easily see if it is normally, then it is blocked. And if it, yes, head tilt, chin lift, yes, open airway. Clear. So I have tried to cover many things. I know that much more things are left, but at least this session would help you. Hope so. So thank you. Best of luck. Remain positive for your exam. Never ever feel depressed. Whatever you have done in past, forget. I say whatever you have done in past, forget. Just start from now. Even then you have sufficient time to clear your exam with very good marks. So remain connected.